Welcome to Health Talk with Dr. Almus McDowall, your guide to better living and natural wellness. Discover the power of alternative medicine, holistic health tips, and transformative practices for a healthier you. Join us on this journey to revitalized well-being.
Pleasant good day to all our viewers of the station. A great pleasure to be here once again. I'm Dr. Almus McDowall, and I'm a naturopathic doctor who practices natural medicine. I'd like to welcome you to this program. Our program for today, we'll be speaking about diabetes. And we all know that diabetes is one of the most debilitating diseases that you can find in this world. And when someone is diagnosed with diabetes, especially at an early stage, it is very important to treat this condition aggressively. So you go to the doctor's office or to the hospital or to the clinic, and a blood test is done, and it shows that your blood sugar is elevated. And sometimes elevated can mean 120 deciliter, or it can be probably 7 or 8 millimoles. At that stage, the diabetes situation is not really that bad. If it's not treated aggressively and you just continue your normal lifestyle, sooner or later this condition is going to become worse. So it is important at an early stage to treat diabetes in a very aggressive manner. In some cases, most doctors, if their sugar level is not too high, they would advise you to go on a proper diet, cut back on your sugar intake and also the starchy foods. Starches are some of the most dangerous foods that we can consume excessively. And when I use the term excessively, because a lot of us eat a lot of starchy foods and we do not consume enough vegetables. So we go and we buy a meal at a restaurant, it's all filled up with all kind of different starches and very little vegetables. So the salad's always just a small amount, but the starches, there's so much of starches on your plate that in itself can be very dangerous and can lead to diabetes. Now, diabetes is not just something that will just happen to you like that. Some people probably might be suffering from diabetes for over a year or more, but never really knew that they have diabetes. And so this is the reason why I mentioned a blood test sometimes is what really inform the doctor and the patient that this individual is suffering from diabetes. So most diabetics are suffering from a condition called insulin resistance. And insulin resistance means that your insulin cannot enter the blood. So the blood cells, these cells are resisting insulin from entering in order to neutralize or to metabolize sugar or to break down sugar in the blood cells. And so this is the reason why all that sugar remains in the blood, and automatically the sugar becomes out of control and you start experiencing diabetic related symptoms such as frequent urination, excessive thirst, dry lips, and also sleeplessness. You drink a lot of water all the time. You just keep asking for water. These are some of the symptoms of diabetes. So if you are experiencing any of these symptoms that I've just mentioned, make sure you see your doctor, or if you're close to a clinic, go to a clinic and have your blood sugar level checked. If you're over the age of 40 or 50, you should really have your blood sugar checked on a more regular basis, because people at that age tend to develop diabetes compared to younger people, especially when I speak about type 2 diabetes. In the case of type 1, it also affects juvenile, but in case of type 2, it's mainly this called onset diabetes or adult onset diabetes. So it's really important for you to understand. Now, being diabetic, as I mentioned earlier, is a very debilitating disease if it's not treated properly. And then you can start developing serious problems such as renal failure, And in the case of renal failure, when you're diabetic, it affects the kidneys, and your body produces the amount of insulin that the body should produce, and also, even though your body is producing insulin, in the case of insulin resistance, still that insulin is not entering the cells, so you always have lots of blood sugar in the body. And so it is important to understand that when you have high levels of blood sugar, it overworks the kidneys, so the kidneys get very weak, and the kidney cannot function to its optimum level, so there are times you might have renal failure. This is one of the worst things that can happen to anyone, is to have renal failure, because not too soon from that you're going to be on dialysis. Dialysis is when you are put in a machine to detoxify the body or to get rid of all the waste from the body. So you're hooked up to the machine, and the job that the kidney is supposed to do to filter waste out of the body, now a machine is doing it for you. So you then have to go to the to be dialyzed maybe 3 times a week, 2 to 3 times a week. Very important information that you should really take into consideration, because this is really, really bad. Another area of concern is erectile dysfunction in men. A lot of men who are suffering from high levels of blood sugar, if their diet, especially if the sugar is not controlled properly, it can lead to erectile dysfunction, and you might not be able to perform in bed as you like to. Another area that I like to bring to your attention to is diabetic retinopathy. There's some people, when they're suffering from diabetes and the sugar level is extremely high, it affects their eyesight, so they cannot see properly, and then you can lose your eyesight when you're suffering from diabetic related retinopathy. Another area is diabetic neuropathy. This is when the blood sugar level is extremely high, and it starts affecting the nerves. It interferes with your circulation, and you start getting tingling sensation, numbness under the sole of your feet, because both, and also sometimes you might have cramps and all of these different symptoms in the leg. Now, some of these might not be related to diabetes, because they're just suffering from general neuropathy and they're not diabetic. So it's really important to understand that there are many areas of great concern when it comes to diabetes that you should be looking at. Diet plays a very important role in helping to reverse and also to treat your blood sugar. So if you stick into a very high fiber and also a diet that's very high in vegetables, then you would find the blood sugar level is going to go down, especially fiber in the case of rolled oats. Rolled oats has been found to be very effective in helping to bring the blood sugar level down, but you need to know there's a way to prepare it, and I cannot tell you this here because I would not have enough time. If you like to find more information, you probably need to call the number on the screen. At the end of my program, there will be a number that will appear. You can always call the office, book an appointment to see me, and I can assist you of how you can control your blood sugar, even though you're on medication and those medications are not keeping the blood sugar level under control. I have a special program that can help you to control the blood sugar even while you're on your own medication from your doctor. So it's really many more complementary, and it is important that you try to keep that blood sugar level at a normal level, because it is dangerous if your blood sugar is very high. It doesn't give you a lot of leeway when it comes to eating certain things, because if your blood sugar is high, you cannot have ice cream, you cannot have things that are sweet, or any drinks that are sweet. If you want a glass of sweet wine, you cannot have it, because it's only going to elevate the blood sugar to another level. So these are some of the areas that you need to look at when it comes to controlling your blood sugar. There is a natural medicine that is called berberine, and there have been several studies on this natural formula that is very similar. It does the same thing almost what metformin does to the body without the side effect. Metformin do have a lot of side effect. This this natural ingredient, this natural herb called berberine, has over 2,000 to 3,000 years, been used by the people of China for many years. It's been shown to be very effective in reducing the blood sugar level and to control it, very, very similar to metformin without the side effects. So there are many natural ways that you can control your blood sugar. Diet, exercise, you drink adequate amount of water daily, you make sure that you, you take your medication on a regular basis, and exercise, as I cannot overemphasize how important it is for you to follow a proper exercise program, especially if you are capable of exercising, because I know some people might not be in a position to exercise because they might have an amputation of a leg, and they might not be able to go out walking. So diet plays a very important role. There are some exercises you can probably find on YouTube, even though you're lying in your bed, that can help you to improve your blood circulation and also to help to improve your blood sugar level also too. So as I said, if you like to get more information on this program and any of my other program, there's a YouTube, there's a page that we have this information on YouTube, our website, Facebook, and also Instagram. All of these are areas you can reach me, or you can get some of my other products that are being advertised there. And my clinic, you can always, call the number to get the information on my clinic. And so this is where I end this program. I like to say again, thank you for viewing this program. And in the next week, again, we would also bring you another program. So I want to thank you so much. On behalf of my team here, I'd like to thank you. Have a great day.